I'm Beverly Kirk here with Sharon Stash. She's the Deputy Director and a Senior Fellow with the CSIS Global Health Policy Center, which has just released a new report on global health policy in the second Obama term. We're talking about HIV/AIDS. Thanks so much for being here.
Thank you.
Well, first of all, there are a couple of very exciting shifts going on in U.S. engagement in HIV/AIDS, and one is called the AIDS-Free Generation. Can you tell us what that's about?
Over the last 10 years, the U.S. government made an unprecedented investment in HIV/AIDS programs, with a particular focus on several countries in which rates of HIV are extraordinarily high. It's been a tough battle. There's been many obstacles. The scientific challenges, the programmatic challenges have been huge. 10 years into programming, new scientific discoveries have really paved the path for much more effective HIV prevention programs. These strategies were put forth in a statement by Secretary of State Hillary Clinton last November, and a blueprint for creating an AIDS-free generation was produced by the Office of the Global AIDS Coordinator in December. According to the strategy, key investments in high-impact HIV prevention interventions now make it possible to dramatically reduce rates of HIV transmission.
And so does this mean when you say AIDS-free generation, the goal is ultimately AIDS-free, no one has HIV?
Well, the definition is actually fairly specific. There are three goals that were outlined in the AIDS-free generation approach. On the one hand, investments in high-impact HIV prevention are expected to dramatically reduce rates of new infection in young people. Newer, more effective approaches to preventing mother-to-child transmission now make it possible to virtually eliminate infant acquisition of HIV. And finally, the policy calls for countries to continue to provide treatment to those that are eligible.
Now, the other shift, it comes in terms of PEPFAR and the transition. In Southern Africa, the government has already initiated some of these transition plans where the country in question provides more financial support for the national HIV/AIDS program, and the PEPFAR financial support progressively gets lower and lower. Talk about how this is happening, and is it going to be a challenge?
Well, the President's emergency plan for AIDS relief was begun under the Bush administration at a time when a very small percent of people globally were on treatment for HIV/AIDS, resulting in the deaths of tens of thousands of people on an annual basis. Those major investments were done as an emergency response to facilitate rapid scale-up and broad availability of HIV treatment and prevention services. It's been 10 years. Huge progress has been made in putting people on treatment. The U.S. government is now beginning to transition into a different role in the international AIDS response. On the one hand, instead of providing direct financial support for delivering HIV/AIDS services in developing countries, we're now moving toward a model in which we provide technical assistance in key areas to support governments take primary ownership, leadership, and management of their national HIV/AIDS programs. So that's called PEPFAR transition. It goes along with the expectation that U.S. government monies and investments in HIV/AIDS will be reduced.
Now, how orderly is this transition going to be? Will there be countries that have difficulties?
Well, we've made a couple of trips to the countries that are really sort of at the forefront of trying to implement PEPFAR transition. The idea has been on the table for 5 years. Countries of South Africa, Botswana, and Namibia have undergone perhaps the most serious efforts to really begin that implementation process. South African government, where we were last month in particular, is really leading the charge on national ownership, a stronger responsibility, larger country investments in its HIV/AIDS response. South Africa now covers about 70% of its overall HIV/AIDS expenditures. But the transition is not going to be easy. There are a couple of major concerns, lots of uncertainties. As U.S. support is decreased, national support needs to increase. And this is particularly true in South Africa, where where only about 53% of people who need treatment are currently receiving treatment. So the government has no choice but to continue to expand its national program, even as PEPFAR monies decline. and we have been paying for a large proportion of services. A second critical challenge in that same area is that in South Africa in particular, the U.S. government worked to provide HIV treatment services largely through non-governmental organizations. This allowed rapid scale-up of treatment at a time when the South African government was less receptive to HIV/AIDS programs. Part of the transition in South Africa is having the national government assume that treatment burden. South African government will now be the main provider of HIV/AIDS services, and all the people started on treatment under PEPFAR, there's 1.7 million of them last year, are going to be transitioning from non-government organizations to the national government service providers. So there's a concern about keeping people on treatment and maintaining that treatment in the long term.
All right, Sharon Stash, thank you so much.
Good.